Teaching students who have difficulty walking or moving.
What is the meaning of an orthopedic impairment? Orthopedic impairment is defined as a child's disability relating to a bone, joint, or muscle that is severe enough to directly affect the child's educational performance. It can be caused by many different factors, including genetic abnormalities disorders such as cerebral palsy or an injury that has caused a missing limb or has impaired a muscle.
Orthopedic impairment has three causes, namely musculoskeletal disorders, neuromotor impairments, and degenerative diseases.
Musculoskeletal disorder or MSD are injuries or disorders of the muscles, nerves, tendons, joints, cartilage, and spinal disc. It is also composed of various conditions that can result in various levels of physical limitations. There are three most common musculoskeletal conditions which are composed of trauma, back pain, and arthritis, for which healthcare visits to physicians' offices and hospitals which occur every year. Orthopedic disorder caused by musculoskeletal disorder include defects or disorders of the bones and muscles, such as limb deficiency. A child may be missing a part or all of the limb due to trauma disease or a birth disorder such as clubfoot. So let's talk about the types of musculoskeletal disorder. One of the example of the musculoskeletal disorder is the clubfoot. Clubfoot is usually present at birth. It is where the baby is born with a foot or feet that turn in and under. It occurs when tissue connecting muscles to bones are abnormally short. It causes the foot seem twisted and mishapen. It also can cause mild to severe difficulty walking, but doctors are generally able to treat clubfoot successfully with surgery. Treatment is necessary to correct clubfoot and is usually done in two phases. It is casting and bracing. Remember that clubfoot won't get better on its own, in which it is need to be fixed with surgery.
The second type of musculoskeletal disorder is scoliosis. Cause of most scoliosis is known, but it involves an unnatural curvature of the spine. Occurs in youth right as they hit the growth spurt before puberty. Most cases are mild, but some cases will call for a corrective brace or even rotating or twisting of the spine, which could cause severe pain and difficulty breathing. It is an abnormal lateral curvature of the spine and most often diagnosed in childhood or early adolescence. The spine's normal curves occur at the cervical, thoracic, and lumbar regions in the so-called sagittal plane. Scoliosis affects 2 to 3% of the population or an estimated 6 to 9 million people in the United States. Scoliosis can develop in infancy or early childhood. However, the primary age of onset for scoliosis is 10 to 15 years old, occurring equally among both genders. Females are 8 times more likely to progress to a curve magnitude that requires treatment. So as you can see, if you look in the picture, there's a big difference because the picture on the left side is straight or normal because it doesn't have a curvature, and its spine, which is opposite on the picture in the right side where the spine is curved towards the left. So these are the three causes of scoliosis which can be classified by etiology. First is the idiopathic. So idiopathic scoliosis is the diagnosis when all other causes are excluded and comprises about 80% of all cases. Adolescent idiopathic scoliosis is the most common type of scoliosis and is usually diagnosed during puberty. Second is congenital. Congenital scoliosis results from embryological malformation of one or more vertebrae and may occur in the location of the spine. The vertebral abnormalities cause curvature and other deformities of the spine because one area of the spinal column lengthens at a slower rate than the rest. And lastly, the neuromuscular. The neuromuscular scoliosis encompasses scoliosis that is secondary to neurological or muscular diseases. So this includes scoliosis associated with cerebral palsy, spinal cord trauma, muscular dystrophy, spinal muscular atrophy, and spina bifida. This type of scoliosis generally progresses more rapidly than idiopathic scoliosis and often requires surgical treatment. The last type of musculoskeletal disorder is the absence of some member. So it is a long-term disability in which a child is either born without a limb or has somehow had a limb amputated. This causes a restriction of movement and physical ability.
At this part, we will learning about neuromotor impairments. A neuromotor impairment involves the central nervous system. But before anything else, we will define what is central nervous system. The central nervous system is the body's processing center. The brain controls most of the functions of the body, including awareness, movement, thinking, speech, and the five senses of seeing, hearing, feeling, tasting, and smelling. In other words, the spinal cord is an extension of the brain. The impairments affects the child's ability to move, feel, or use certain parts of the body. It involves an abnormality or damage to the brain, spinal cord, or nervous system that sends impulses to the muscles of the body. The neuromotor impairments can be acquired at or before birth and often result in complex motor problems that can affect several body systems. These motor problems can include limited limb movements, loss of urinary control, and loss of proper alignment of the spine. There are over 50 diseases and disorders associated with orthopedic impairments. There are 3 types of orthopedic impairments, and one of these 3 types is a neuromotor impairment, and it has 2 most common types, which are cerebral palsy and spina bifida.
There are 3 types of neuromotor impairments. First is cerebral palsy. Appearing in the first few years of life, movement is impaired because the motor skill areas of the brain development abnormally or become damaged. Kadalasan lumalabas ang mga senyales at sintomas ng cerebral palsy mula sa pagkasilang ng bata hanggang bago sila magsimulang pumasok sa paaralan. Iba't iba naman ang paraan kung paano nahahayag ang sakit na ito. May mga batang may cerebral palsy na hindi makalakad, mayroon din namang nakakalakad bagamat hirap. As a result, fine motor task and posture is affected. Second is spina bifida. Occurring during the development of the fetus, spina bifida is a cleft spine or incomplete closure of the spinal column. Children will have a loss of feeling or paralysis under the point of malformation. Ang spina bifida ay karaniwang nakilala bago at kapag napanganak. Nagaganap rin ang diagnosis kapag nasa hustong gulang na. Ito ay karaniwan sa spina bifida occulta kung saan walang mga sintomas. Gayunman, habang tumatanda ay maaaring hindi ito masyadong magkaroon ng lugar sa katawan di tulad na kapag ang batang nagkaroon ng sanhi nito ay humahantong sa mga isyu kung saan karaniwang matutuklasan at nadadiagnose ang spina bifida. Third is traumatic brain injury or TBI. TBI occurs from a blow to the head that is so severe that it harms normal brain function. Ang traumatic brain injury or TBI ay nagaganap kapag ang biglaang trauma ay nagdudulot ng pinsala sa utak. Ang TBI ay maaaring magresulta sa biglaan at malakas na paghato ng ulo sa isang bagay o kapag ang bagay ay tumusok sa bungo at pumasok sa tissue ng utak. Ang pinakakaraniwang sanhi ng TBI ay kinabibilangan ng mga aksidente sa sasakyan or car accident, mga kilos ng karahasan or physical assault, at mga pagbagsak o pagkahulog or head injury when falling down.
And now, let us move on to the next topic, the degenerative diseases. Degeneration refers to the process by which tissues deteriorates and loses its functional ability due to traumatic injury, aging, and wear and tears. What are the most common degenerative diseases? Some of the most common types of degenerative diseases are cancer, diabetes, Parkinson's, Alzheimer's, rheumatoid arteries, and osteoporosis. Millions of people around the world are affected by these diseases. Degenerative nerve diseases affect many of your body's activities, such as balance, movement, talking, breathing, and heart function. Many of these diseases are genetic. Sometimes, the cause is a medical condition, such as alcoholism, a tumor, or a stroke. Other causes may include toxins, chemicals, and viruses. What are the types of degenerative diseases? One of these are muscular dystrophy. There are several types of muscular dystrophy that affect different muscle groups. All types involve progressive muscle weaknesses and difficulty with motor skills. Some types are fatal. Muscular dystrophy occurs when there is a genetic mutation in the genes that create proteins that protect muscle tissue. How does a person get muscular dystrophy? In most cases, muscular dystrophy or MD runs in families. It is usually develops after inheriting a faulty genes from one or both parents. MD is caused by mutation or alterations in the genes responsible for healthy and muscle structure and function. Is muscular dystrophy fatal? Some types of muscular dystrophy, such as Duchenne muscular dystrophy in boys, are deadly. Other types cause little disability and people have a normal lifespan. Who is most likely to get muscular dystrophy? Muscular dystrophy occurs in both sexes and in all ages and races. However, the most common variety, Duchenne, usually occurs in young boys. People with a family history or muscular dystrophy are at higher risk of developing the disease or passing it on their children.
The second types of degenerative diseases is the multiple sclerosis or MS, a disease in which the body's own immune system eats away at the myelin sheath that protects your nerves. This deteriorates the nerves, causing miscommunications between the brain and the spinal cord. This can cause difficulty with walking, speaking, and motor skills. The third types of degenerative diseases is the polio. Polio is a contagious viral illness that can be transmitted through water, food, or direct contact with someone with polio. Symptoms can range from mid-flu-like symptoms and stiffness in the limbs, which is non-paralytic polio, to the loss of reflexes and paralysis. It is called paralytic polio.
What are the characteristics of orthopedic impairment? The referral characteristic for the student with an orthopedic impairment or OI fall more into the area of physical characteristics. These may include paralysis, unsteady gait, poor muscle control, loss of limb, and etc. An orthopedic impairment may also impede speech production and the expressive language of the child. Although IDEA or IDEA groups orthopedic impairments together, children with disabilities can actually have orthopedic impairment or neuromotor impairment. Orthopedic impairment involves bones, joints, limbs, and muscles. Neuromotor impairment involves the central nervous system, the brain, and the spinal cord.
It's very sad to know that for those children who have this, what we call orthopedic impairments is affected, especially their school performance. According to IDEA, or the Individuals with Disabilities Education Act, the orthopedic impairments can be caused by congenital anomalies such as clubfoot, diseases such as osteogenesis imperfecta, or other causes such as cerebral palsy or amputation of limbs.
Classroom accommodations and modifications. How to accommodate children with orthopedic impairments in school. The children may face include special seating arrangements, larger tables, note-taking assistance, and instruction focus on impairments in the improvement of gross and fine motor skills. A student may need a special setting arrangements to help him with posture and mobility, as moving around the classroom or moving around in school hallways may be difficult. Schools may also need to arrange the schedules for these students in a way that prevents them from having to travel long distance from one class to another. Another examples of classroom accommodations and modifications for students with orthopedic impairments are securing assistive technology and augmentative communication devices, extended time to complete assignments, and teacher awareness of students' condition and its effect, such as timing easily. These students, they need assistive technology device to help them communicate or lessons that address their disability, such as those that will help them improve their gross and fine motor skills devices, and technologies that might be utilized may include wheelchairs, specialized discs, gains, scratches, communication software, or speech recognition software. Teacher in all subjects areas should be aware the impact of an orthopedic disability on students' behavior in class. Students with these impairments, for example, might get tired more quickly than their peers without orthopedic disabilities.
Assistive technology. Assistive technology devices help students with various levels of severity of orthopedic impairment. These devices enable access to the educational curriculum and may include one or more of the following. First, there is a speech recognition software, alternative keyboards and mice, augmentative and alternative communication devices, word prediction software, screen reading software, and academic software for students with disabilities.